The Sandstone detox level of care specifically is for people that have had kind of a higher level of use. They tend to have withdrawal symptoms that they can't manage at home and they need better nursing care or better provider care. We provide that here.
Addiction is a full-time job. It becomes all-consuming and it leads them down roads that they don't want to be on.
So when we think about detox, this is a residential level of care, right? So people are living here. So we want to make sure that the treatment journey is as comfortable as possible.
Typical day at Detox is going to be waking up, receiving medications if they receive morning medications, hygiene, showering, brushing teeth, changing clothes out of our pajamas. Then they are going to serve breakfast, have some nice nourishment to start their day, followed by their morning clinical group, which is going to be led by one of our clinicians here on site. Then they will transition to some kind of silent activity, break time, quiet time, followed by lunch, and then we will have an evening afternoon group as well that is going to also be led by one of our clinical staff members. Again, they'll get some quiet time, downtime after that to engage in some of the fun activities. Then they will receive dinner, and then it's quiet wind down time.
And so the goal here is to keep the environment with minimum restrictions.
When a patient comes into Sandstone Care, we're not just looking at the individual, we're looking at their realities in their life.
It's really understanding what has been going on, what was going on, and really helping us put together a better picture to help best serve somebody. They don't realize some things that happened when they were 6, how that could be still affecting them now. So biopsychosocial is putting the puzzle pieces together for us.
Sandstone Care makes sure that all of the patients get the medical support that they need by doing a thorough intake initially to find out what their current situation is before coming to detox, and ensuring the continuity of care with all of those medications that are appropriate.
There are a variety of medications we can provide to a patient to help decrease their risk for relapse, help decrease cravings, and make sure they're maintaining sobriety and continuing on with treatment.
We manage medications as needed and also urgently, so we are on call throughout the night in case something doesn't go according to plan. When we talk about medication management with our clients, we are discussing how medications are used appropriately.
Medication-assisted treatment is one tool for treating the patient in terms of the whole patient concept.
So we know that almost everyone that comes to us for detox has a co-occurring disorder, meaning they are struggling with mental health and substance use.
Perhaps someone's suffering from a major depression, which they're trying to manage through drugs or alcohol. Or they started using drugs and alcohol and now, they're depressed.
Sometimes we're not exactly sure which came first, but we know that both need to be treated. We can't really treat one without treating the other one.
I would say that vast majority of people are using substances for underlying mental health issues that are uncontrolled. In addition, it's imperative to find these things early so you kind of break the cycle of addiction.
We do both individual and group therapy here at Detox because we know that both are really beneficial. We know that a lot can come out of the group process, normalizing what they're going through.
It can just be a great source of support, so the person that is in detox and working with their addiction knows that they're not the only person going through it. When they finally get to this point and they're trying to make a change, they realize they're not alone, they can start to talk about it more.
There's this concept of universality that we see in groups that we don't get out of individual care. And so we know that group is really impactful. And also group is very much a microcosm of the world outside of here.
After they participate in their group therapy and they really build a comprehensive master treatment plan, then we move into the discharge planning process. What that looks like is after they're done with their treatment journey at a medical detox level, they're going to transition into a lower level of care. What that means is once they're stable, they can step down into a lower level of care because we know that the longer that someone is engaged in treatment, the better chance they have of success.
Look, sobriety is a journey, and you don't know where that journey is going to end. You don't know what the middle of the journey is going to look like. At the end of the day, all you need to do is take the next step.
Sandstone Care Detox here in Virginia lives in its integrity, that we're not just here to get a paycheck. That's not what this is about.
If you're on that fence and you don't know what tomorrow's going to look like, your wedding's going to look like, when you're going to graduate college, when you're going to move out of your parents' house, I don't have all those answers, but I can tell you what the next step is. Take your right foot and just come into Sandstone.